Patient A, who was diagnosed with osteoarthritis of the hip, underwent stem cell therapy. During the treatment period, they suffered a stroke and started stem cell therapy for the stroke in June this year. They have received a total of 3 doses so far.
My spouse would say something, but I couldn't react. In the beginning, I was treating my hip joint and had been treating liver cells, and I had seen on the internet and other sources that there was a way to do it with intravenous drips, so I wanted to give it a try. That's why I decided to attempt this method of treatment using intravenous infusions based on the information I had gathered. The reason is that once a dense color develops, it is said to have a high probability of recurring 2 or 3 times. So I wanted to reduce that risk as much as possible by receiving stem cell treatment in advance.